what is the backstory of starting your practice, which is called Health and Healing DPC? What's the backstory? What happened there?
Yeah, so I was part of the big system, as you mentioned, for the last 8 years, and with a big HMO system, and then with an academic institution the last couple of years. And it doesn't take long to realize that what you were trained to do, you have very limited capacity to apply in your actual practical life. You see about 25 to 30 patients a day in a busy primary care office. You really have limited ability to take care of multiple problems. I mean, the complexity when it's somebody who's very complex requires a lot of time. You just can barely scratch the surface sometimes during your visit. So after many years of that, you start to feel, the classic signs of burnout, which is the futility and just what am I doing, and am I making a difference, and the depersonalization of patient care. And so I think for a while, you sort of translating that into, okay, I just can't take care of patients. It must be the patients. And so then that's why a lot of docs will go more the administrative route or the academic route and become teachers to get out of patient care. What I learned about direct primary care from a former colleague, and I just thought that's just genius. I mean, the fact that we can see, have a smaller panel of patients and be able to utilize all of the training that we've acquired with it, which is a lot of mental health, a lot of counseling, a lot of education, a lot of sort of coordination of care, be able to utilize that with the time that you're given is really the genius in that model. And so seeing that even just in the first 3 months, the time that I'm allotted with these patients, like I've realized it's never was patient care that burned me out. It was the system that burned me out. I'm learning to love my patients again and learning to love the patient, the patient care part of primary care. I mean, I wouldn't have done primary care if I didn't love
Hmm.
people. And I'm learning that, it was never their fault. It was never the patients. It was the way we were practicing and imagining that we could take care of complex disease states and multiple problems and lists of problems in a 6-minute visit. I mean, there's just no
It's
way
like
to do
speed
that.
dating, but no,
Yeah,
wrong.
in a bad way. Yeah, in a
You,
bad way.
you and
Yeah.
Doctor, one of my previous guests, Doctor James Tinsley, was out in Newport News. One of the things that he said, and he loves this. He's doing the same thing, same business model. And I said, "You're living your purpose again, aren't you?" And he said, "Yeah, yeah."
Yeah. Mhm.
And I define purpose as the reason you exist. And I think physicians, doctors are very lucky in the sense that from a very early age, usually a lot earlier than some of us, you discover what your purpose is. You've got a pretty good idea. And if you're going through medical school and then residency, boy, that's living your purpose and you're on your way. And I can't imagine what it's like to go into a system and then have it corrupted over time. And I always say to people, keep in mind it is the system, not the doctor. Always look at the system first. If you're going to complain, always look at the system. And this goes back to
Mhm.
business 101 with W. Edwards Deming back in the 70s, and a lot of people have to Google that one, but he's the one who turned Detroit around to some extent and bringing
Mm.
quality and understanding that with more variables means your line slows down, and any production line worker can tell you that. But
Mhm.
for those who are wondering about what direct primary care is, how do you explain it?
Yeah, I think I basically tell people it's really a throwback, to how we used to care for patients 30, 50, 30, 40 years ago, where the patient doctor relationship is really back at the forefront of what's important in the office. I mean, the office is now run basically on the priority is the patient and our relationship. And so it's really the payment model that's different. The payment model is the patient or their employee or their employer sometimes, but most of the time the patient will pay a monthly fee to be a part of a practice. And the practice then now is accountable to the patient, right? And we don't take any insurance. So we are no longer accountable to any third-party payers. We don't have to do any sort of referral systems or go through any prior auths usually. And so we can practice medicine in its purest form, which is doing what's best for the patient.
Hey, thanks for listening to another healthy snack from the winning healthcare food fight snack bar. If you're finding them tasty, please click like and consider subscribing to have more guilt-free snacks as they're served. Listen to the full show by following the link in the description.